On behalf of us as HuQAS, as the HuQAS team, HuQAS Secretariat, I want to really welcome you to this 24th Annual Scientific Conference, the 24th of what we've had for the many years.
I'm Oduro Tieno, and in the medical practice, I provide consulting services in patient safety and quality improvement in the country. I also serve the private sector as the Vice Chair Health Regulations, Quality and Standards Committee at the Kenya Healthcare Federation.
Jina naitwa Nairobi, ni mtaalamu wa maabara kutokea mgodi wa Bulyanhulu wa dhahabu, Tanzania.
My name is Robert Sang. I come from Kericho County. I work at Kericho County Referral Hospital as a laboratory scientist, currently playing a role of the laboratory manager in that facility.
I'm Charity Nagasha. I'm a medical laboratory technologist. I work with Mayanja Memorial Hospital, Barara, Uganda. I work as a lab supervisor for that facility.
My name is Peter Kibet Kipchim. I'm a practicing medical laboratory scientist. I also have a role as the chair in the Clinical Chemistry Association of Kenya, which is a national society for clinical chemists.
Thank you, first of all, for coming and being with us here to be able to see whether we can discuss the key factor which is transforming healthcare through excellence in what we do in the lab.
This is a very powerful theme in terms of transforming how healthcare is delivered in this country. We want to reach a point where there's excellence in healthcare through the work that we do as medical laboratory science. So we converge here from all walks in the country, practicing laboratory technology scientists and officers to discuss issues that would help us to move our services to an excellence point to ensure that patient outcomes are the best possible that we can achieve in this country.
Within the country, we've had various instances and key issues that are coming up, especially with the governance of the health system, and excellence sits right at the center of each and every action that is coming around within the health system.
Juu ya mada hii, kwanza ni nzuri. It's very nice because the lab is the center for diagnosis, because most of the diagnosis, about 70 to 80% comes from the lab. So once we provide excellent laboratory services, it means tunasaidia hata katika diagnosis ya mgonjwa.
And it has come to us at the right time when even the government is rolling out on universal health coverage, and laboratory medicine is also critical when it comes to implementation of the same.
As a family of HuQAS, we are in celebratory mode. The journey to a Kenyan homegrown EQA service provider started exactly 25 years ago.
Our last 25 years as an organization, we have stood firm in this matter in terms of quality in the lab, addressing it not just here in Kenya. Last year we were in Tanzania, Dodoma, where we held the conference in conjunction with the Medical Lab Association. The year before that, we were in Kenya, in Mombasa, and the year before that, we were in Uganda.
HuQAS is now active in more than 25 countries across Africa. Not just in the East African region, but across Africa. And the journey continues. Only 2 weeks ago, we were trying to assess the logistics of bringing on board a potential client from Turkey. The head court, they contacted us. They wanted to partner with us to offer EQA services in Turkey.
We are pushing the boundaries of this discussion to the East African community and to the larger African community. We are trying as much as possible to make sure that as an organization, we are putting our best foot forward in delivering quality in the lab, not just through EQA, not just through mentorships and the trainings that we are holding, but more in terms of these fluid discussions around principles, science, and quality and patient care at large.
We might be holding the 24th annual HuQAS conference today was a great milestone in the history of the organization. It's HuQAS Jubilee, and we are very, very happy that when we look back, at least we can see the steps that we have been leaving behind, steps that relates to the improvement in quality care of our patients, and especially in terms or in matters laboratory diagnostics. We expect an exciting two-day conference where participants shall share insights into new developments and advancement in laboratory medicine and application of quality management systems.
What stood out for me is that there is indeed a lot of work that is going on within the lab space, the lab science space. And what stands out for me is that for this work to make impact, we need to publish more and bring more of this work out there so that we are able to consume of it at a large scale. For example, the presentations that are coming around from Kenyatta National Hospital with regards to issues around pediatric pneumonia and bone metabolism cases was quite insightful, and I think within the lab science and the lab practice space, we need to be publishing more and bringing more of this kind of information to the general practice areas to inform decision making and excellence within the practice.
I have been a keen member attending these conferences. The only time I didn't attend is when the conferences were happening outside Kenya. But whenever it's happening within Kenya, I have been a key attendant. And my thoughts about it is that I have seen this conference scale up the excellence in provision of relevant presentations as far as healthcare service delivery is concerned, within and without. Because I have seen participants come all the way from within East African countries, and this one is a mileage because we are getting to learn of what our peers are doing in their country. So to me, it is actually the right thing, and it is quite informative as far as quality healthcare service delivery is concerned to the citizens.
Leo, unlike the one that I attended previously, kilichonivutia leo, cha kwanza kabisa ni mada ambazo zimeongelewa leo na jana pia katika mkutano. Cha kwanza kabisa kilichonivutia ni kwenye ku prioritize safety of patient. Yeah, you know, this is a patient-centered approach. So once you prioritize the patient safety, unamweka mteja wako au mgonjwa katika nafasi ya kumhudumia vizuri. Nimejifunza vitu vingi. One of the things key kabisa nimejifunza ni kutoka kwenye ile ISO 15189 ya 2022. Kwamba there have been, these days we don't talk about non-conformances, but it's more of a risk assessment approach to prevent the non-conformances from happening.
Since the year 2022, how many years after that?
3.
3. We don't talk about non-conformance. It's like we know is it Salga, accidents will happen, and then we start talking wamekufa 10, and then the next. So you understand, we are talking of risk management, right? What can go wrong, right? When we understand what can go wrong and then mitigate, actually we are not going to have our non-conformances, right? The year 2022, ISO 15189 actually changed and included risk management. For what? To imagine what can go wrong in the pre-analytical, analytical, post, right? And the continuous quality management, so that you have everything documented. This can go wrong, so how do we prevent it? So we are talking more of prevention than waiting for an accident to happen and say, wamekufa watu 28. And then we start changaring money and then burying them. And then we wait for more to die, and then, you understand? So that is the change. It's the most critical change that has happened to 15189. So the issue here is risk management to minimize any non-conformances, potential non-conformances. And when you do that, actually you work in a safe laboratory. So think about what can happen before it happens, and you actually make a big difference. All right? So where ISO 15189 is at the moment. And that has also changed ISO 9001. Risk management has been added, okay? And that is why we have some upgrading of those accredited labs to the ISO 15189 2022 version. Does that change your thinking? It is not a question of we have many CAPAs, we have many no, we should have less because of the risk management.
From a previous year's conference that we did in Tanzania, we ended up finding that there's a lot of transformations that were happening, from artificial intelligence that's coming on to a patient care, healthcare bill that's being implemented in the country, to shortages in the workforce, changes in the healthcare systems and processes, implementations of universal health coverage. There were so many transformations around the healthcare system, our ecosystem, and we felt it was important to shed a light on this for this specific year's conference. So
this year's session has really given me an insight on two things, I must say. One is on the bill that is being developed that will take care of healthcare service delivery in the country. It is nice to know that in the near future, we will be having an authority that will take care of three key fundamental things. One is on registration of facilities. Number two is on licensure. And number three is accreditation, meaning they will standardize the service delivery and it will make it affordable and accessible to many Kenyans. Number two is on the presentations that have been delved during this presentation. It got actually enticing to me to know that most of the researchers are operational, and it will catapult the service delivery in the various facilities. So I must say this year's presentations, so much of it have been giving us a leeway, or now we really need to transform service delivery using the available resources and make it equitable and available to all.
All the interactions that I've had here in Nairobi has opened my mind as someone coming from Uganda, and this has showed me where there's a gap and where I need to fix. Back in our area there in Uganda, it is not easy for us to have such kind of conferences. It usually doesn't take it. The health sector there doesn't usually take it up. But it's good here, you're practicing it and you're doing it perfectly. I think it's almost yearly, right? Yeah. So I've learned, first of all, I'm not yet accredited. My lab is not yet accredited. So moving forward, I'm going to do that. I've had some courses about accreditation. So moving forward, I'm going to first run on the accreditation part of it. Then in the same run, I'll be doing the EQA. I've not been doing EQA. So in this, I'll pattern with the HuQAS through the ChemLab. ChemLab is the one that sponsored me to come here. So I'll pattern with these two, and I'll see how to get the EQAs done. So moving forward, my lab has to be accredited, and I have to practice EQA for excellent work.
The key takeaways is that we as laboratory practitioners, we need to come out and have more vibrant discussions and share experiences that we have so that we can improve the systems, embrace whatever is coming in, because we have to embrace the changes that occur constantly so that we can always improve and keep up the pace in terms of the new technologies that come in. After even a session that we saw about AI coming into the lab, those are very important discussions that we need to have, and we need to embrace them so that we can improve on what we are doing on a daily basis. And association with other people, I would encourage more members to, when there's an opportunity, to engage with their professional in forums such as webinars and conferences, physical meetings. It is very important because there's a lot to learn that cannot be explained in a short video.
Whatever work each and every lab is doing across the country can be cross-shared so that we build a system of learning from peers, where Lab A, Lab B across the country is able to tap into the resources and the materials that one lab in the country has done and learn from that instead of relying on knee-jerk reactions that are coming out of instances that may be well resolved by work that has been done by another lab elsewhere. So that for me, I think, is a key area that labs should cross-reference and benchmark and tap into the peer learning systems that are available within the country.
Take home message ambayo nitarudi nayo kwetu Tanzania ni katika kuanza kujiengage kwenye EQA services ambazo zinakuwa offered by HuQAS. Kwa sababu currently ninakofanya kazi hatupokei hizo services. So I think it's a privilege and it's a chance for me to take that back home. Ili na sisi HuQAS waanze kuwa natumia EQA samples. As a result, in the coming days, na sisi tuwe accredited.
In the near future, out of the things that we have learned out of this conference, I've gotten to see that no one is limited. The resources that are in circulation are enough to start us off to ensure that quality service delivery is worked on whatever facility of stations that we are working on. It is possible to make sure that you enhance on service delivery and make it quality so that Kenyans can feel safe when we are offering these services, and they will have a lot of confidence in us, the providers, as the government is also working on the aspect of financing so that the health service delivery can be achievable to all of us.
Looking ahead, I think one of the biggest things that I'd be looking forward for is to, again, push this conference out. A few years back, we had the pleasure of taking the conference to Uganda. We then took it to Tanzania, and God willing, we'll be taking it down to Kigali, Rwanda. And the same idea is pretty much it. We try as much as possible to speak to the quality of medical lab testing, see how we can improve the competency and the skill level of our people, so that at the end of the day, patient care, patient safety becomes more central and more accurate, and then we'll be all the better for it in the region. Let us remember that the lessons of the 25 years of excellence is built on one method at a time, one standard at a time, one patient at a time. If we align our methods with standards, our data with actions, and our expertise with genuine collaborations, then we will not only transform healthcare, we will also make the transformation durable, measurable, and fair.